As we now know the results of blood tests conducted on a Ukrainian national detained in hospital here in the capital last week. This follows public concerns on whether a case of the deadly Ebola virus was detected here in the Bahamas after rumors surfaced in social media. Jimenita Swain has tonight's top story.
Days after that alleged Ebola scare caused panic on social media nationwide, officials from the Ministry of Health revealed the conclusive results of the additional tests conducted on the blood sample of that Ukrainian victim that died of malaria here in the Bahamas, and not Ebola. Health Minister Dr. Perry Gomez explained the findings at a press conference Sunday morning.
Laboratory tests were done at the Centers of Disease Control and Prevention in the United States of America to establish the presence of any other infectious diseases, including Ebola virus. All tests done were negative.
Dr. Gomez was also questioned about the timing of the ministry's response in light of the fact that online voice notes about the suspected case of Ebola had gone viral.
We had to wait until Parliament was finished for me to make a statement, and that turned out to be very late at night. But it wasn't entertained until, I would say, around 6 o'clock, when we appreciated how viral the thing had become.
Officials from Doctors Hospital, the Ministry of Health, and the Department of Public Health collaborated on the case. Doctors Hospital Chief Medical Officer Dr. Charles Digges outlined the sensitivity in revealing any information about the case in light of public health implications of the diagnosis.
About whether that was an opportune time to release information to the public. We understood that the priority needed to be the care to treatment of the individual, the protection of the institution, and the collaboration between public health and ourselves to make sure that the overall Bahamian health was not at risk.
Doctors Hospital Chief Executive Officer Charles Seeley also listened to the voice notes that went viral, but admitted there was no immediate information to identify a primary source.
I can speak very comfortably and say that there is a stringent protocol in the institution that we maintain privacy and confidentiality of our patients. To the extent that an investigation was launched in our institution, the answer is no, as to whether one of our persons may have offended.
Health officials maintain that if there is a threat to public health, they will address it. For now, they say they will remain vigilant in protecting the public's health, but stress that there are no additional screenings in place following that bogus Ebola scare. Jimenita Swain, ZNS Network News.